Sarah. I'm part of the Nottinghamshire Mental Health Support Team. We're a team of NHS staff working with schools to help improve the emotional health and well-being of young people across Nottinghamshire. We're hoping to work alongside young people, their families and their teachers to help identify any needs they might have at an early stage so that we can get the right support in for them.
Hi, I'm Georgina. I'm one of the education mental health practitioners with the mental health support team. The three key hopes for the service are, firstly, that we can deliver evidence-based interventions to children and young people. So these are treatments that have been clinically proven to help treat common mental health difficulties such as anxiety or low mood. Secondly, the early identification of mental health difficulties, and this means that children can access the right service at the right time for them. And thirdly, to work with the mental health leads in the school to deliver a whole school approach to mental wellbeing. And this means that we would work collaboratively with education staff to ensure that we nurture the wellbeing of all of the pupils in the school.
Hi, my name's Elsie Glover. I work for the Nottinghamshire Healthcare Trust as part of the mental health support team. As part of the mental health support team, we offer one-to-one work with children and young people, as well as supporting their families and carers. As part of that one-to-one work, we support children and young people with their mental health difficulties. For example, if a young person was experiencing low mood, as an education mental health practitioner, we would offer skills and techniques to the young person. Part of the mental health support team, we also offer group work for children and young people in a school-based setting, and that can be a variety of groups and workshops, such as worry management to exam stress. And furthermore, our aim is to empower children and young people to take control of their own mental health and well-being, as well as supporting families to feel confident to support the well-being of their children and young people.
So I'm Sam Cameron Hodge, and I'm an education mental health practitioner with the mental health support team, and I'm going to be talking about what treatments with us, with the team, what it looks like, so what you would do if you were following a treatment plan with us. So what would happen is, in the beginning, we'd come into school and we'd do an initial assessment in school, which would just mean us gathering some information about what it is that you're experiencing, and then we would talk to you about what different treatments we can offer. We'd ask you about your goals to see what it is that you'd like to get from treatment, and from that we can, together with you, we can decide what treatment would suit you best. We would then be coming in to see you again in school every week or every fortnight to do regular sessions, and during those sessions what we do is provide you with knowledge, but also with resources like worksheets and things like that for you to take away and practice the skills that we teach you. So it could be diaries, or it could be practicing actual skills and things like that. And a lot of the work is done by yourself between sessions, and we're kind of like a personal trainer, so we're there to kind of meet with you regularly and see how you're getting on with the work, help you to solve any problems that you might be having, and really try and help you progress to whatever your goal is.
Hi, so I'm Tracy Duke, and I work within the mental health support team as an education mental health practitioner. I work within the Mansfield, Ashfield area, which is one of our areas where we kind of go in and support within schools. So I'm going to talk to you today about our referral process. So how do you actually refer young people into the mental health support team? So what do you do if you have concerns about a young person within your school that's in one of our areas within our project? Then what we can do is go and see your mental health lead within that school. The mental health lead will then talk to you and go over your concerns for the well-being of that young person, and then they will do a referral which is written out and it's sent into our SPA, which is a single point of access within our project. They will review it and then they will make a decision of whether the referral can come into our team If it's not going to go into our team, then they will give you a call back and see where to signpost that young person to. We can also do we're taking self-referrals now from parents and young people. So if you feel you need some help, you can ring the SPA, which is a single point of access again, within CAMS, and then you can do a self-referral, and if you are in one of our schools within the project, then they can actually then refer into us. Okay, thank you.
Hello, my name's Sarah. I am a trainee cognitive behavioural therapist with the mental health support team. When that referrals come into us, a member of our team will allocate your case to one of our staff members. One of our team will then contact you or your family to arrange an initial assessment. We'll probably give you a call and book that session in. That will be at school. Currently it's remote, but it will be at school. We will arrange an initial assessment, which will generally last between an hour and an hour and a half. Before that assessment, we'll send you some questionnaires to fill out, which we then share the results with you in either the initial assessment or session 1. Following that initial assessment, we will discuss as a team what intervention we think would be most helpful for you, and then you will be allocated to one of our team. That will either be an education mental health practitioner, a CBT therapist or trainee CBT therapist, or one of our specialist practitioners. And depending on who you are allocated to, that will depend on how many sessions you get going forwards. After you've had your course of sessions, so your sessions will be on a weekly basis, generally based in school. Some sessions might take place out of school, depending on what kind of treatment that you're having. Once you've finished your sessions, your worker will discuss with you if you think you've achieved your goals, if you've worked on what you'd like to work on, if you feel that you're able to go out and you can manage whatever difficulty it was you referred to us for, then it's time for you to be discharged from our team. And when it's time for discharge, we will send you a letter with all the treatment that we've gone through, what you've managed to do in sessions. It might contain some data from the questionnaires that we did at the start. We'll also ask you to complete a questionnaire at the end of treatment as well, hopefully showing a change in your scores. And then once you've been discharged, the discharge letter will be sent to you and your family, to the referrer, which will either be school or yourself, and also a copy will go to your GP as well.
Hi, I'm Laurie Potter and I'm one of the project leads for the mental health support team. So I'm going to talk a little bit about the whole school approach. So the whole school approach is about embedding the ethos of mental health and well-being into the day-to-day school life. It's about working collaboratively with school staff and health services to promote the mental health and well-being of children and young people in a school setting. It's about looking at school policy. It's about supporting staff resilience. We are big believers that you're not going to have emotionally resilient children without emotionally resilient staff. So it's actually looking about the bigger picture of mental health and not just focusing on need and when children need intervention. It's about how can we make schools promote health and well-being, and look at things in classrooms that actually can promote the health and well-being of children and young people every day, whether that's mood boards or check-ins with children. The whole school approach is really important about future generations. So in schools, the saying goes that safeguarding is everybody's business, but actually in the mental health support team, we believe that mental health and well-being of children and young people in schools is also everybody's business. And establishing a whole school approach is basically giving that key message. So it's everybody. You might be the person that child feels safe to come to talk to. So it's about educating staff in schools and working together to promote positive mental health for children of the future.